Hello, Professor Jody. My name is Anna. Here we go, our final exam. This is my model, my husband Neil, and he'll be helping me today. So at first I would be introducing myself again. My name is Anna. I'm going to continue my physical exam. I would start by washing my hands, and we'll start with the heart. So at first I would palpate his heart with both of my hands for thrills, which would mean vibrations, anything that would indicate increased blood flow. Then I would palpate the PMI, which is located in the mid-clavicular line, fifth intercostal space, right over here. Then I would grab my stethoscope and listen to heart sounds. And my heart sounds, I would start with the aortic heart sounds, which is in the second intercostal space, right side of the patient. Then I will go to the pulmonic, which is also second intercostal space, left side of the patient. Then I would do Erb's point, which is between second and fifth. Then I would do tricuspid with it, which is in the fifth intercostal space, and mitral, which is the apical pulse, and it's also in the fifth intercostal space. And then I would take the bell of my stethoscope and I would try to listen to aortic bruits, which, for example, would be whooshing sounds, which would indicate less blood flow, and that is not a good thing. Next, we go to our vascular system, and again, I would inspect the skin for skin texture, hair distribution, shiny legs would indicate a vascular disease, any cuts, any scoriations, any nodules, anything that should not be there. So after I inspect the skin and overall assessment, I would do skin tinting. If he was dehydrated, this would stay up, so it's non-tinting, so that's good. Then I would do check the pulses, and I would do both sides just to compare, make sure that are both there and they're equal. I would do the carotid, then I would do the radial pulses, brachial pulses, femoral pulses over here by the groin, popliteal with my hands behind the knees, dorsalis pedis right here on the foot, and then posterior tibial. And then I would go ahead and check for capillary refill on the fingers and extremities. It should be less than 2 seconds. This will be checking circulation. Then I would check his extremities for temperature and edema, especially on the legs, and also would be pitting to see if you can see any pitting for edema. And then I would, and then there's one more. And then I would do Hohmann sign to check for DVT. So I would, can you flex your toes, please? There you go. Dorsiflex, there you go. Thank you. So this will be checking for DVT and if you felt any pain. Then we'll be going to the abdominal area. It will be doing again an overall assessment of the skin. Is the abdomen distended? Are there any cuts, any nodules, any excoriations, anything that should not be there? Next, I would go to the umbilicus, checking the skin around it. Are there any, swelling, nodules, any tender areas? Then I would check for hernias. Can you please lie down? And can you please lift your head and take a deep breath? So if you had any nodules, any masses over here, it would protrude and we'll be able to see it. You would feel pain after that. Can you please stand up? Then next I'll listen to, go ahead and sit down. Then next I'll listen to his bowel sounds in all 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And it should be at least 5 bowel movements per minute, and you will listen, all 4 quadrants for 30 seconds. And then after that, I would listen to the abdominal vessels, and I would start with the aortic one, which would be right down here. And I would do renal arteries, the splenic artery, and iliac arteries, which would be right down here by the groin. Then lie down, please. I would pass on all 4 quadrants, make sure there are no areas of fluids in there, anything that sounds funny. Then I would palpate lightly with one hand on all 4 quadrants, looking for areas of tenderness, trying to feel the organs, anything that should, the swelling or anything. Then I would do both of my hands and palpate deeper on all four quadrants again. Again, looking for areas of tenderness, trying to feel the abdominal organs. Then sit up, please. Then I would look for the Murphy sign, which is the left upper quadrant. And we'll be looking for, in the book it says for you to do a hook method, but that seems a little drastic, so you just kind of press it a little bit deeper to see what you can find if the patient feels any pain. And this way we're looking for gallbladder disease and gallbladder stones. Then we would be doing McBury's point, which is right lower quadrant, and we'll be looking for appendicitis. And also to look for appendicitis, we'll be doing the psoas sign and the obturator sign. The obturator sign, can you please lift your leg? So we'll be pressing down. If you felt any pain, this would be a sign of, could be a sign of appendicitis. And also the psoas sign, can you move your feet like this a little bit to the right, twisting a little bit. And again, we're trying to elicit pain in the right lower quadrant, which would indicate appendicitis. Then turn around, please. We'll be checking for CVA tenderness, which is over here right by the kidneys. We'll be doing a little tap over here, and if you had any pain, it could be a sign of kidney disease. And also, we will be checking rebound tenderness. Check, lie down, back please. Rebound tenderness, if you felt any pain when the skin rebounds, this would be a sign of inflammation of the kidneys. So he doesn't, it's good. Sit back please. So next we'll be going to the musculoskeletal system. And again, I'll be checking for joints to make sure that there is no swelling, no tenderness. If we're looking for symmetry, really is one limb longer than the other. So that's what we're looking for, symmetry. So after I check the joints, I inspect the joints, an overall assessment. I would do inspect the joints. Then we're gonna do range of motion against gravity, and after that we'll do against of motion against resistance. So range of motion against gravity will be during dissection, and then palpation, and then range of motion. So I would start with the TMJ, and his jaw, is his jaw hanging more on one side than the other? Does it feel symmetrical? Then I would go to the neck. Can you flex your neck, please? Extend your neck, and I'll be going the back of the neck. Then I'll be checking his back, and also shoulders. There's one shoulder hang lower than the other. Can you turn around, please? Now we'll be checking his back for scoliosis, lordosis. Can you stand back? You stand up, please. And touch your foot, touch your feet. I will checking for scoliosis, any shoulder that hangs on one side and not the other. Okay, sit back. Sit there. Then I would be inspecting his wrists and fingers. Distal, proximal. Can you switch your finger? Move your wrists. Very good. Then the feet again. Stand up and raise your leg. Raise your leg. Put it to the side. Again, and the other one. The other one. Both legs again. When you check one, you check the other. Sit up is in your feet. Move your feet. Rotate your feet. The other one. Okay, very good. Do rotations with your shoulders. I can do that. The other way. Okay, very good. Sit down, please. And after checking all of that and inspectioning and doing the range of motion against gravity, what would you do against motion against resistance? So I would do the major muscle groups. Can you try to lift your shoulders? Very good. In your arms. Very good. And again, you do one and you do the other to compare. And can you lift your legs, please? Okay, very, very good. This one here. Very good. And then after that, we would do musculoskeletal. And then we do rapid alternating movements with your arms like this. Very good, very good. Make sure that he's got good cerebellum function and also a grip. Can you grip my arms? Very good. My hand, I mean. Very good. Okay. So now we'll move on to neurological system. I would use a cotton tip and a cotton wisp. I'll ask the patient to close his eyes and ask if he feel on the same on each side. You feel the same on this side as on the other side. And I will check his face, arms, hands, legs, and feet. So we'll go like this. Does this feel the same as this? Close your eyes, please. This feel the same as this. And then arms, hands, legs, and feet. And I would be palpating for pain, tenderness, sensation of touch. And then I would do deep tendon reflexes. This is my reflex hammer. And I would be starting with the biceps, triceps back here. I would do the brachioradialis right over here. I would do the knee right over here. And again, the patient needs to be relaxed. That's the key if he's a tense patient for it to work. Achilles. And then Achilles right over here. And then the Babinski reflex, which you should be able to crawl his toes when I do this. Then lie down, please. I'll be doing the straight leg raise. Raise your leg, please, 90 degrees. And if 90 degrees, very good. If it doesn't elicit pain in his lower back, that means he could have some kind of a lumbar disease. Sit down, please. Very good. Now we're finally going to our genitalia and rectum. First, I would inspect the skin for any redness, excoriations, anything that should be there, any swelling, any cuts. First, I would be, so after doing the overall assessment, I would start with the umbilicus. Is it round? Is it red? Is it tender? Is it distended? What is going on? Then I would start, check for hernias, any masses. I'm sorry, not hernias, but already check that. That's different. So we start with the umbilicus. Then, no, I'm sorry, I'm getting confused. This is the genitalia part. So I would start inspecting the skin around the genitalia, make sure there's no, like I said, any redness, tenderness, nodules, anything that should be there. Then I would inspect the genitalia, the skin, again for redness, tenderness, cuts. Then I would inspect the perineal area, again a little bit broader, again for tenderness, cuts, nodules, masses, anything that shouldn't be there. Then I would inspect the rectum. Again, checking the skin again for redness, tenderness, nodules, anything that shouldn't be there. Then I would do a digital rectal exam looking for fistulas, hemorrhoids, any nodules, anything that shouldn't be there. And after that, I would do a breast exam if he was a woman. And then I forgot to say we should always respect the patient's privacy and put hands on before we do the genitalia and the rectum. Close curtains, put the gloves on, do all the exam, and then take gloves off when you're done. And then I believe that's it. That is our assessment. Thank you so much, Professor Jody. It was great working with you, and hopefully we'll see each other again on campus next semester. And have happy holidays.